All right. We're going to talk a little bit about shock and, as an EMT, how you can recognize when a patient is in shock during its earliest stages and perhaps even identify the cause, which will help guide your treatment. So, we learned earlier that perfusion is the delivery of oxygen and nutrients to the cells and the removal of waste products, and that perfusion required an adequate pressure, an adequate blood pressure in order for that to happen. Hypoperfusion, not enough perfusion, is the result of a breakdown in the cardiovascular or cardiopulmonary system. A breakdown in this system will lead to not enough delivery of oxygen and nutrients to the cell, and as importantly, not enough removal of waste products, and will lead to cellular death, tissue death, organ death, and eventually death of the organism. Now, shock can be categorized into 4 different categories. Hypovolemic shock, hypo, not enough, volemic referring to volume, so shock caused by not enough blood volume. Then there could be distributive shock. That's a shock where you don't lose volume per se, it's just being distributed somewhere else in the cardiovascular system. Cardiogenic shock refers to the heart as the cause of the shock, the heart not working well as a pump. And obstructive shock refers to something obstructing the flow of blood in the system. Now, when your body senses that the pressure in the system is dropping, there are compensatory mechanisms that kick in an attempt to keep your blood pressure normal. Signs that this is occurring includes, first, an increase in respiratory rate. When the body senses that the cells aren't getting enough oxygen, that will trigger you to take deeper, faster breaths. So initially we're going to see an increase in respiratory rate. As it continues, the brain is going to be the first organ to show dysfunction from not getting enough oxygen. So you may have an altered mental status. You may have a change in their level of awakeness or alertness. In order to keep the pressure up in the system, the body is going to also release hormones like epinephrine, like norepinephrine, and dopamine. And these are hormones that will cause the heart rate to increase, that will cause the vessels to constrict, to raise the pressure in the system. So the release of these chemicals, we'll see an increase in heart rate. We might even see or feel the pulse initially being bounding as the heart beats harder as a result of epinephrine. Norepinephrine causes the blood vessels to constrict, to raise the pressure in the system. And when the blood vessels constrict, the blood is shunted from outside, from the arms and legs, outside the core of the body, known as the periphery. So the arms and legs, the blood in the arms and legs is shunted to the core, causing the skin to be very pale, very cool, and sweat glands are under the control of epinephrine as well. So sweat glands become hyperactive and you begin to sweat. So a person who is compensating for shock is often pale, cool, clammy, with an increase in respiratory rate above normal, with an increase in heart rate above normal, and perhaps an altered mental status. Now, not all shock presents this way, but the most common forms of shock do. Now, your body is made up of approximately 60% water, and the water is distributed in different compartments. 75% of your total body water is inside your cells. 5% of your total body water is inside your blood vessels. And then that space between your cells and your blood vessels, known as the interstitial space, that makes up the other 25% of total body water. Interstitial fluid is important because if cells need more water, they can pull water from the interstitial space into the cell to keep it hydrated. If you need more blood volume, more fluid in the vessels, the body can pull water from the interstitial space into the blood vessels to expand the volume as well. Now, it's the brain and the kidneys that regulate thirst, but also eliminate excess fluid. And it's the proteins in the blood plasma that pull fluid into the bloodstream. We talked about capillary permeability in our last discussion, and how when capillary permeability increases, fluid is allowed to move out of the capillaries and into the interstitial space. When you lose too much fluid, and here we're talking water, not blood, when you lose too much fluid, that's called dehydration, and that's a decrease in total water volume. And you can lose this, you can become dehydrated from sweating too much, you can become dehydrated from vomiting and diarrhea, and you certainly can become dehydrated from bleeding. Now, when you have poor fluid distribution, that means the water is not getting to where it needs to go. And in some cases, like when the right side of your heart fails, you can develop edema out in the periphery, out in the arms and legs, out in the liver, because the right side of the heart receives its blood from the body. So when the right side of the heart fails as a pump, blood backs up into the body and fills those capillaries full of fluid, causing an increase in capillary permeability, and fluid leaks out of the capillaries and settles in the interstitial space, causing your ankles to swell, your legs to swell, your fingers to swell. Now, the nervous system helps compensate for shock because your nervous system is divided into, as we'll talk about in anatomy and physiology, your nervous system is divided into your central nervous system, which includes your brain and your spinal cord. But then you got your peripheral nervous system, all those nerves outside of the spinal canal, which includes sensory nerves, motor nerves, cranial nerves, and then autonomic nerves, your sympathetic and your parasympathetic nervous system. Those autonomic or automatic nerves control things like heart rate, respiratory rate, control things like gut motility, control things like the release of certain hormones to retain salt, get rid of salt, retain water, get rid of water, all those things that we don't think about. We don't have to think about taking a breath. It just occurs in response to what's going on in and around our bodies. Now, if the nervous system is damaged, then obviously those messages cannot be transmitted properly. Vessels can become fully dilated if the spinal cord is injured, making the container twice as big, so it becomes half as full, and that relative loss of volume, because the container is so big, causes the pressure to drop in the system, and adequate oxygen and nutrients doesn't make it to all cells, and the patient will go into shock. So motor vehicle crashes, falls, diving accidents all can cause spinal cord injury, which can lead to shock. Now, medical dysfunction of the nervous system, as in the case of strokes, and a stroke is either caused by a blood clot in the head or bleeding into the brain itself from a ruptured vessel inside the head, can lead to shock. Infections like meningitis and encephalitis, a swelling of the brain, can lead to dysfunction of the brain, which can lead to shock. And then diseases like Lou Gehrig's disease or multiple sclerosis. These are nerve wasting diseases that eventually lead to the inability to breathe, and patients die because they can't breathe themselves. And other nervous system dysfunction could be caused by low blood sugar as well as high blood sugar. Low blood sugar is known as hypoglycemia, not enough sugar in the blood. Now, your endocrine system is responsible for secreting those hormones that I mentioned. Your endocrine system includes many glands throughout your body, but in the case of shock, the endocrine system is responsible for maintaining adequate temperature, maintaining adequate fluid balance, releasing those hormones, epinephrine, norepinephrine, dopamine, in order to maintain adequate blood pressure, releasing chemicals like aldosterone, vasopressin, all kinds of chemicals that your body creates in order to maintain adequate pressures in the system. Now, the main organ systems in the endocrine system, of course, include the brain, the kidneys. On top of the kidneys sit the adrenal glands. And the adrenal glands are where adrenaline or epinephrine and norepinephrine and dopamine are released. The pancreas is responsible for secreting pancreatic juice, which is important in the digestion of amino acids. But the pancreas is also important because it secretes two hormones, one called glucagon, which raises your blood sugar, and one called insulin, which lowers your blood sugar. And then the pituitary glands, located in the head, control all kinds of things from your metabolic rates, your body temperature, all those sort of things. The thyroid glands sit in your neck, and they determine metabolism. They determine, the parathyroids determine calcium use and release into the bloodstream. And as I've already mentioned, the adrenal glands that sit on top of the kidneys release epinephrine, norepinephrine, and dopamine. So if the endocrine system isn't working properly, it can lead to organ or gland problems. And sometimes endocrine system dysfunction could be present at birth, as in the case of type 1 diabetes, where a child may be born or an infant may be born with a pancreas that does not secrete insulin or doesn't secrete enough insulin. Or it may be the result of illness, as in the case of type 2 diabetes, which occurs when your body becomes resistant to the insulin that you're producing. Now, there's also endocrine dysfunctions where perhaps some of the hormones that are being secreted can lead to problems as well. Graves' disease occurs when the thyroid gland is secreting way too much thyroid hormone. In patients who have Graves' disease, they may have problems regulating their heart rate or their body temperature, but one of the telltale signs of Graves' disease is bulging eyes, protruding, bulging eyeballs that almost look like they're protruding out of the socket. And you see that in patients with Graves' disease. And as I had mentioned, if you don't secrete a particular hormone, it may lead to dysfunction as well, as in the case of the pancreas not secreting insulin, leads to the disease called diabetes. The thyroid, if they don't secrete enough thyroid hormone, that can lead to hypothyroidism, which is very common in many, many people. The digestive system is important because it maintains your adequate water balance in your body, as well as breaks down the food that you eat to supply nutrients and electrolytes to your body. The major organ systems of the digestive system include the esophagus. You also you can't talk about the digestive system without mentioning teeth, tongue, the ability to chew and bite and grind the food up and break it down into smaller particles, where it is swallowed down the esophagus, where it ends up in the stomach, where it's mixed with stomach acids to further break it down, stays in the stomach around 3 hours, maybe a little longer, and then moves into the intestines, your small intestines first, where it's broken down further, nutrients are removed, that sort of stuff, and it propels through the intestines by a process known as peristalsis. It's a wave-like muscular contraction that pushes the food through the intestines, and it goes through the small intestines, and there's the ileum, jejunum, and duodenum, and then from there it ends up into the large intestine. And in the large intestine, there's some nutrients that are still being extracted, but most are already gone by then. What occurs in the large intestine includes the removal of water out of the food that you eat and the liquid you drink. And removing too much water, if that does occur, that's what may cause constipation in some patients. Now, if your digestive system doesn't work right, it certainly is going to affect your hydration levels and your nutrient transfer. But if it's bleeding, it also can pose problems. If you've got a very slow, long-term, or chronic bleed of the intestines, it can lead to a condition known as anemia, where you don't have enough red cells in your blood, and can lead to stroke and heart attack. Or the bleeding could be massive and you could be throwing up bright red blood, or have bright red bloody diarrhea. In those cases, that could lead to hypovolemic shock from loss of volume. Vomiting and diarrhea is probably one of the more common disorders seen with the digestive system dysfunction, and although inconvenient, vomiting and diarrhea often often play an important role in eliminating things in your body that are harmful. As an example, if you take in E. coli, or you take in too much bacteria from the food that you eat, if it's not prepped properly, that could make you very sick and die. But by throwing it up or having diarrhea, you're able to eliminate that, so it poses less of a problem to you. But in any event, over time, vomiting and diarrhea may result in malnutrition and dehydration. The immune system is responsible for fighting infection. So when we have particularly large proteins, when we have viruses, when we have bacteria, fungi invade our body, the immune system identifies them as being harmful, marks them for destruction, and then may develop antibodies that are designed to seek out those antigens and seek out those harmful invaders and kill them. Hypersensitivity can lead to shock as well. When somebody has an allergic reaction, normal allergy occurs in many, many people, particularly in certain times of the year when pollen counts are high or smog level is high. Some people are allergic to, have just seasonal allergies. Those are not those are not anaphylaxis. Those are just simple allergic reactions. Now, if a person has an over-exaggerated allergic reaction, that can cause anaphylactic shock. Allergies, or what we see in a person who is having an allergic reaction, is the result of the release of histamine. Histamine causes the sniffling and the sneezing and the itchy nose and the watery eyes. And in excess can cause the excess production of mucus, can cause the dilation of all your blood vessels, can increase capillary permeability and cause constriction of your bronchioles. So there's all kinds of bad things that can happen as a result of anaphylaxis. And as an EMT, you would be able to administer an EpiPen at this point, and perhaps at some point a prefilled syringe of epinephrine in order to reverse the effects of anaphylaxis. Anaphylaxis is going to produce edema and swelling from that increase in capillary permeability. Anaphylaxis results in a rapid drop in blood pressure, and if not reversed with epinephrine, can be life-threatening from volume loss, can be life-threatening from bronchial constriction, and not being able to breathe. So in closing, just remember that cellular metabolism requires a constant supply of oxygen and glucose, and the absence of either component disrupts normal metabolism. So if I don't have an adequate supply of oxygen, or I don't have an adequate supply of sugar, I'm not going to metabolize normally. And abnormal metabolism is going to lead to the production of byproducts that are can be lethal as they accumulate in our body. Also, the energy produced when not using oxygen is very little at all, and not enough to support our life for any length of time. The cardiopulmonary system combines with the respiratory system to provide oxygen at the cellular level. In order for us to get oxygen to our tissue, we have to have an open, patent airway. We have to be able to get that air into our lungs, where the alveoli fill up with that freshly oxygenated air, and oxygen moves into the pulmonary capillaries, and then an adequate blood pressure pushes that blood to all parts of the body, to all tissues of the body, so that cells can receive the oxygen they need in order to live. Shock occurs when the cardiopulmonary system fails, and cells no longer receive an adequate oxygen supply. Also, as part of this, know that shock has many levels, many causes. It's not always just fluid loss that causes shock. Certainly can be the pump fails, could be fluid loss, could be the container fully dilates, or all the blood vessels fully dilate. So there's a variety of different causes of shock, but shock will lead to death if not fixed. And the body is composed primarily of water. 60% of it is water. And the water is distributed through 3 compartments in the system. You've got about 70% of it in the cells themselves, about 5% of it in the blood vessels, and the rest is in that third space, that interstitial space between the cells and the blood vessels. And it's important for it to stay there and to be there in an adequate amount, because as your cells need more water, it'll pull from the interstitial fluid. As you lose blood volume, it'll pull water from the interstitial fluid to keep your pressure up as well. All right, so that's the end of our talk on shock. It was short and brief. We will discuss different types of shock in greater detail, or refresh your memory about those when we get to those individual chapters or those individual PowerPoints in the book that discuss those types of shock. So if you have any questions, you do know how to get a hold of me. Thanks, and I will talk to you soon.